Hello everyone, this is Harry Koster with Spine and Rehab Specialists. Today I'm going to talk about a little bit more of a unique syndrome that we see sometimes in the clinic, and it's called Snapping Scapula Syndrome. Yes, that's really the name, Snapping Scapula Syndrome. There's actually a more scientific name for it, scapulothoracic crepitobursitis. Well, that's a mouthful, so we're going to leave that one alone. This is a condition where there is a friction of the scapula, the shoulder blade, on the rib cage, and it creates an irritation in this area, resulting into, kind of a snapping, grinding, crepitus kind of sensation whenever the scapulothoracic joint, so the joint between the shoulder blade and the rib cage, gets moved. Now, typically that is with overhead movements, say, for instance, here, that last little bit of movement, that's when the shoulder blade really starts moving. Let's go sideways, kind of the same thing here. You can see, like the first part, not much happens in here. The later part, that's when really that shoulder blade starts moving, okay? So if we have a problem in this little corner here, so here you see the shoulder blade, typically this will move as the arm moves. There are some tissues underneath here, a bursa, tendons, muscles, that can kind of get entrapped, can start getting irritated, and the constant rubbing, that starts creating irritation in this area. So that's really what the snapping scapula syndrome is, where the scapula just over these irritated tissues starts snapping, grinding, and that's what causes this. Now, a lot of times this condition may go undiagnosed, because you may feel it when you're moving your arm overhead and it kind of snaps a little bit, but you ignore it and don't do anything about it. So we don't really know exactly how many people have this, but I've seen it a number of times in the clinic, and it can be quite debilitating. What's causing this? So it is an abnormal movement happening in this area, right? So it can be from overuse, especially if you're doing a lot of stuff overhead. It can definitely create that. It can be because of trauma. If you fall on this area, fall on your shoulder, maybe fall on your upper back. It could be because of rib injuries, rib fractures, something like that. That can be related to it. Can also be because of posture. So now it gets to be an important one for everybody, because who doesn't have bad posture at times, right? So posture can be part of it. Sometimes it's even just the abnormality of the scapula itself. All our bones are shaped just a little bit different. Like we have the same body parts for the most part, but there's different, shapes, and sometimes you can have some curvature of the scapula that now increases that rubbing on the rib cage. Sometimes it's a medical condition like rheumatoid arthritis, or maybe some sort of a tumor or so that's occupying space in here. But all of these things can lead to this conditioning, happening. Most of the time, it's a gradual happening over time. But of course, in the case of trauma, it can be a sudden onset. What's going to happen in here as these tissues just get irritated, you start having more and more pain. And as you have more pain through a process called inhibition, your muscles will get weaker because you're just not using them as much. So, and that will kind of exacerbate the whole issue, because also one of the factors that plays a role in this is weakness of the muscles surrounding your shoulder blade. And this can even happen, like even people go to the gym, they may have, really strong deltoid muscles because they're doing arm lifts and everything, but that doesn't mean that these muscles surrounding the shoulder blade will automatically be strong. So definitely working on, stabilization of the area will be a big thing. So now I'm going to have Chris here slouch a little bit, okay? So when he slouches, so you can already see there's traction on these tissues. Now lift your arm up, Chris. So now there's just more stuff happening. You can even see him struggling a little bit more to go up there. So, definitely, bring it down, correcting that posture, and now doing it again. Much easier, smoother movement, so less, compression in this area. Well, what do we need to do to prevent this? Well, let's have a good posture, nice strong shoulder muscles, and let's not overuse them a whole lot, right? So you're a weekend warrior and you start, painting ceilings. Maybe you need to take a break from time to time, but a lot of it will come on over time. So posture is going to be a key thing. Nice, strong shoulder muscles will have a lot to do with it. So treatment-wise, so when somebody starts having this, the first line of defense is definitely physical therapy, right? There's two ways that you can go. You can do physical therapy, you can do surgery. They both have very similar, pretty decent success rates. So my recommendation is try the therapy first, do that for maybe 2 or 3 months. And then if that doesn't work, you would go into surgery, because the surgery is quite complicated and pretty invasive. What we would do is we do an assessment to see what's going on, right? So we would look at somebody's posture, we test their strength, look at the scapular mobility to see, see what's happening, and then, if needed, maybe refer, out to the doctor for, x-rays or an MRI to see if make sure there's no lesions underneath that it isn't related to maybe a really strangely shaped, scapula. And then we would start addressing whatever the deficits are. So postural correction for sure, strengthening exercises of this whole area. A lot of times with these patients, what we see is scapular winging, where there's actually no control over the scapula starts sticking out. Chris doesn't have that, so that's good for him. But you can definitely then see that that's a sign of these muscles being weak. So we would really work on strengthening the scapular muscles. So that has a lot to do with it, and really assessing the mechanics of somebody's movement, because maybe when he's going over there again, maybe he's slouching, and then when he works overhead, it really puts pressure in this area over here. We would do local modalities to help with pain and inflammation, because it's definitely an inflammatory process of that bursa that's in here. Now, what is a bursa? Well, maybe you want to know. Bursas are little pockets of fluid that help disperse friction in different parts of your body. You kind of have them throughout your whole body. There's two common ones in the shoulder blade area, one here on the bottom and one here on the top, that help glide the scapula over the thorax, over the rib cage, because that's what needs to happen. So therapy-wise, local modalities, strengthening, working on posture, and then if this doesn't work, there's a surgical option. In the surgery, typically what they do, they either remove the soft tissues that are irritated and inflamed, like the bursa, so it would be a bursectomy, or they take out the little corner of this bone just so that it's not digging into some of these tissues. That's obviously up to the surgeon, depending on what he sees. It has a good success rate, but as you can imagine, it's not a simple surgery. When they start going in, they're cutting through muscles and cutting out maybe a piece of bone. So if possible, try to avoid it and come to therapy first. So if anybody has this crepitus, this grinding, popping in this area, consider you may have snapping scapula syndrome, and you may have to come to therapy to address that.